I want to thank my colleague from Wyoming, Senator Barrasso, for his work on this and other issues related to the President's health law. As a leading orthopedist, I have nothing but respect for him. And as a former medical liability defense lawyer, defending doctors, nurses, hospitals, and other healthcare providers, I really appreciate really good doctors, and this is one good doctor. He and Dr. Coburn are two of the best people I've known, and great credits to the profession. But I want to thank him for his work on this and other issues related to the President's health care law. He has been tireless in his careful analysis and fair criticism of the health spending law, and I believe we are in agreement on the bill's fundamental flaws. The President and his allies repeatedly promised that the health law would decrease costs. That is not going to happen. The so-called Affordable Care Act is going to, in fact, drive up the cost of coverage. And among the biggest reasons for this inflationary impact are the taxes that will be imposed on the American people to pay for the law's $2.6 trillion in new spending. At the top of the list of senseless cost-increasing taxes is the law's tax on health insurance. It is not clear to me how the cost of health insurance will decrease by taxing it. Many people probably don't even know that this tax exists. Like most of the taxes in ObamaCare, its implementation was conveniently delayed until after the 2012 presidential election. But this tax is coming. It is going to hurt employers and employees. It is going to be a drag on our economy, and it is going to depress wages. So I'm glad to be standing here with my friend Senator Barrasso as we introduce the Jobs and Premium Protection Act, a bill that repeals this onerous and counterproductive tax on American workers and job creators. The President speaks about the need for Congress to do something about jobs. Well, we would go a long way toward creating the conditions for job growth by passing this legislation. Unemployment in this country remains a full-blown crisis. Millions are out of work, and the 9% unemployment rate does not begin to capture the full extent of our jobs deficit. We need policies that will encourage businesses to invest and expand. Yet the health law's insurance tax does just the opposite. According to a recent analysis, in just the first 10 years, the insurance tax would impose $87 billion in costs on businesses and their employees. Revenue that could be spent on higher wages, new hires, and capital investment, increasing jobs, and growing the economy will instead go to pay this tax. And that is just the start. In the second decade, this tax will cost businesses and their employees $208 billion. It is important to understand how this insurance tax will work. Starting in 2014, health insurance companies will have to pay a tax based on their net premiums written in the fully insured market. This is the market where 87% of small businesses purchase their health insurance. It is the market where the self-employed and uninsured go to purchase insurance. So who will pay this tax? Someone has to pay it. Contrary to the talking points that all too often come out of this administration, all of these new mandates and regulations are not free. Someone has to foot the bill. And ultimately, it will be those least able to afford it that are paying it. Primarily small businesses and their employees will be responsible for paying this tax. When the cost of coverage goes up due to this tax, employees will pay for it in lower wages or higher health care costs. According to a recent study, the average employee with a family plan will see his or her take-home pay reduced by $5,000 over the next decade because of this tax. The American people should remember that statistic the next time they hear their liberal supporters of the health care law talk about wage stagnation or income inequality. The cost of this tax will be felt by citizens even beyond those small businesses. The factories that lose orders because of their customers' health care costs are going up will pay for this tax. And those searching for work will feel it too, because money that could go to new wages for new employees will instead go to pay for this tax and increased health care costs for existing employees. Now, this tax will hit wide swaths of the American economy with millions of businesses and individuals impacted. A study by the National Federation of Independent Businesses shows that this tax alone will lead to a loss of 125,000 to 249,000 jobs between now and 2021. The legislation we are introducing today will help to reverse this trend. Ultimately, all of Obamacare must be repealed. I am fully committed to uprooting it in its entirety. It undermines our Constitution and it undermines personal liberty. It exacerbates the nation's debt crisis by creating and expanding entitlement spending. And it also undermines our economy, destroying existing jobs and preventing the creation of new ones. The people of Utah and people all over the United States need a jobs agenda. Repeal of the health insurance tax through the Jobs and Premium Protection Act we are introducing today would do much to address the scourge of unemployment and get our economy moving again. Mr. President, I yield the floor.